Victoria and New South Wales are divided over whether to reduce the country's standard week-long COVID isolation period. Joining us live now is the State Secretary of the Health Services Union, Gerard Hayes. Gerard, good morning to you. So what do you believe, if anything, that the mandatory COVID isolation period should be dropped to?
Yeah, good morning, Pete. Look, I think it's something that we need to have that discussion this week. The community has been working incredibly hard over the last 2 to 3 years to get to the point where we're at, and they certainly need to know the way forward. There's huge pressure on the health workforce, the aged care workforce, as we're also seeing in many other workforces, and we need to be able to support those workforces. Seeing at the moment 2,500 people a day furloughing, many of those who ultimately won't be unwell. So I think we're at the point now where personal responsibility is important, and living with COVID is got to be something we're going to get used to.
So how long should people be isolated for if they test positive to COVID?
Look, in my view, I think we should be looking at anyone who's symptomatic should be isolating while they have those symptoms, and so they're not going to pass that on. I think one thing that we have learnt out of the COVID experience is whether you've got the flu, the measles, chickenpox or any other infectious disease, you should not be able to spread that throughout the community and should take the appropriate personal responsibility to stay home. So hopefully the National Cabinet will be looking at these measures will not only support the workforce, but will also support the community in starting to progress forward in relation to opening up the economy.
You can still have symptoms, though, after 7 days, so that would mean nothing changes.
Look, I think that's true, but many times, and the experience, I think most of us all had COVID now, it could be 2 to 3 days that you've got symptoms. So obviously each individual is going to be different, and it's important that we can actually make sure that we don't get to a point where people are not being compliant at all anymore. And that was a concern a little while ago when there was a view that maybe take away the isolation allowance for particularly those who are casual workers. After 2 years, if we are at the point where we start to throw compliance out the door, not get vaccinated, we have further problems. So I think we've got a tired community, a frustrated community, and one that needs to know what is the roadmap going forward.
Do you think that's already happening? That people are just going to work sick?
I think people sometimes are avoiding being tested. I think that's happening at the moment. I think when people have a choice whether do I have a cold or will I have a test, maybe they'll not have a test. And this would be disappointing greatly due to the fact that we've got through this together and we get to the back end of something that will be here forever, and we start to move away.
So just to get back to the key point here, you believe that as soon as you test negative or as soon as you don't have any symptoms, you do a rat or whatever, then you just go back to work, whether that's 1 day or whether that's 7 days?
Look, I think that's the sensible way forward. That will ensure compliance within the community. But not only COVID now, we should be talking about the flu. I had someone turn up to work recently with the flu, and maybe 2-3 years ago that would be acceptable. It's not now. So I think we've learned a lot of lessons through COVID. We just need to apply them.
What do you learn? I mean, this is already in place in other countries around the world. Have you got any data on how that's affecting staff and would probably relate to Australia?
Look, I could tell you now that the 2,500 people who are furloughing at the moment in health in New South Wales, that will decrease, which will assist the workforce. But importantly, if you do have COVID, you do isolate. So we just don't want to get people into the position where we're not going to comply with what is sensible and reasonable and is going to support the most vulnerable in the community.
No, I agree with you, Gerard, and particularly because the worst of winter, I think it's safe to say, is now past, that we're heading into the warmer months, and meanwhile cases are on the way down.
They are, and whether it's a hospital, whether it's queuing up at an airport, we've got to look at ways of utilising the workforce we have, understanding that the workforce, particularly in health, is exhausted, and how we support that workforce, but how we get the outcomes that we need forever, not just for the next 2-3 months. COVID's not going away. It's another infectious disease that we've got to learn to live with. And I think the community is mature enough to understand personal responsibility is a good way forward.
Okay, that's Gerard Hayes, the Health Services Union there. Thank you, Gerard. We'll talk to you again soon.